Good afternoon, everybody. Time is very short. I just go my topic. Homeopathy is safe, much less expensive, non-invasive, viable alternative for the treatment of patients suffering from loss of lumbar lordosis. Lumbar refers to the lower back section of spine, and lordosis refers to the spine of C-shaped curvature. When there is a loss of lumbar lordosis, their lower spine's natural inward curvature has become straighter, making the section of the spine flatter than it should be. The symptoms are the lumbar lordosis, also known as a flat back syndrome, and have many causes including aging, degenerative disc disease, ankylosing spondylitis, spinal stenosis, vertebral compression fracture, scoliosis, spondylolisthesis, trauma or injury, muscular imbalances, poor posture, obesity, surgery. Symptoms of loss of lumbar lordosis include back pain, stiffness, limited mobility, difficulty standing up straight, fatigue, radiating pain to the buttocks or legs. Its consequences increased stress on the spine, accelerated degeneration, decreased mobility, impaired balance and coordination, potential for neurological problems like numbness, tickling, etc. My case was a published paper on Journal of Pharmacopuncture. A boy aged 16 years visited my clinic on March 28, 2016 and was external curvature of his lower back, which gave him a tilted posture with signs loss of lumbar lordosis, including scoliotic symptoms. Before coming to the clinic, he visited the clinic of some renowned orthopedic, neurologic physicians or surgeons. Couple of months he took allopathy medicines and advised by the different orthopedic physicians, but without any apparent amelioration of his suffering from a gradual development of leaning forward flat back and awkward curvature of his waistline sideways and downward and pain. Gradually, he started becoming almost immobilized because of his continuous severe back pain during normal movement of the body. He was referred to the possible surgical interventions. The guardians of the family, who otherwise belonged to the lower middle class, were unable to arrange for the cost of surgical intervention and further medical treatment. Finally, the patient was brought to our homeopathy clinic by his family members on a van rickshaw. He was lying in a peculiar posture with the help of the strategic pillow support. The patient examined and the symptoms were mind anger, irascibility, anxiety, irritability, quarrelsome posture. These are the symptoms. I just first did MRI and X-ray reports before the treatment started. The curvature already flattened and straightened. The calcareous force is indicated and 30C was prescribed firstly and followed by 30C repeated and 200C and 1M also. And last report, MRI report revealed remarkable amelioration of the loss of lordosis and favorable changes. No obvious osteophytic or degenerative changes, end-plate changes were found. Vertebra showed normal alignment, height and marrow signal intensity. Now only middle bilateral neural foraminal stenosis was seen at level L3, L4 vertebra. Bilateral facet joints and ligamental flavum were normal. Visualized chordaequini and conus pectoralis appeared not to be normal. No abdominal soft tissue was seen. Bilateral sacroiliac joint space were normal. Posterior elements were normal. These all symptoms were modified and improved a lot. This is the actual picture photograph. 1A and 1B before treatment, 1C, 1D and 1E continuing treatment, and 1F and 1G after treatment. These are postural changes. Both scoliotic and lumbar lordotic changes have been corrected by calcareous 1M as our prescription. This is the post-treatment MRI report and X-ray. Discussion taking into consideration the symptoms in totality. After consultation with the repertory of Kent, calcium was administered at 30 potency in repeated doses. The boy apparently started responding suitably after receiving the remedy for about 10 days, but then the subsided pains re-emerged, necessitating the introduction of higher potency, 200C, as per homeopathic principles. The boy again started to recover in all respects, including the first sign of strengthening and curvature of the straightening of the vertebra, and a sense of rapid recovery has his pain had again subsided. In addition, his symptoms of excessive thirst had been reduced to a great extent. His sweating was also diminished. However, after a few days, his pain reappeared, but at a much reduced intensity. This observation indicated the need of a higher potency of calcium 1M. The result using his potency are very inspiring. He rapidly improved further to the point where he no longer needed medication. His X-ray report was also very encouraging and corresponds well with the lessening of the external symptoms. The case was reported and highly diluted potent homeopathic remedies, if selected properly, can work wonders in rendering relief to a patient suffering from difficult physiological conditions, such as one discussed in the report. Furthermore, the study clearly demonstrated that the homeopathic remedy used in this case can provide a viable alternative to surgery for all patients suffering from this rather rare disease. Not to mention being a particular help in providing affordable healthcare to the less fortunate persons in our society. Thank you.
Thank you so much, sir, for such a concise presentation and making the information very relevant. Now I'll be calling on our dais, our last speaker for today, Dr. Abdul Hakim, sir.